Brain injury is the leading cause of death and disability among young adults worldwide. Acute stroke is another leading cause of death and serious long-term disability. Pupillary assessment, as part of the neurological exam, is a routine part of the protocol of caring for patients with neurologic insult and injury, and has been for over 100 years.
It's important to measure a pupil in a neurosurgical or neurological patient because it's an indication of the patient's neurologic status.
Changes in the size, equality, and reactivity of the pupils can provide vital information in the critically injured and ill patient, and are important for prognosis, monitoring, and triaging decisions. Evaluating the pupils has traditionally been done in a very rudimentary and subjective manner by using a pupil gauge or ruler to measure pupil size and a pen light to assess pupillary reactivity to light. Studies have shown this manual method to be very inaccurate with large inter-observer variability.
When patients come in with neurologic injury, many times their pupils are small, they've gotten other medications that also make their pupils small, and it becomes much more difficult to quantify the pupillary response. A manual method leads to less standardization in looking at pupillary response when you compare it from practitioner to practitioner.
The Neuroptics NPi 100 Pupilometer removes subjectivity from the evaluation of the pupils by accurately measuring the pupil size and reaction to light.
We use the pupilometer in patients in the intensive care unit who have head injury or stroke or brain tumors.
Unlike other components of the neurologic exam that require patients to be conscious, the pupillary exam is one of the few neurologic signs that can be assessed in an unconscious or sedated patient. If the pupillary examination is important enough to be included in the protocol for the treatment of severe traumatic brain injury and in the evaluation of patients with suspected stroke or neurologic insult, then it is important enough to use an instrument that enhances the ability to obtain an objective evaluation.
The pupilometer is important in adding to the neurologic exam because the pupilometer allows for an objective measurement of pupillary response, a great indicator of looking at neurologic deterioration in an objective way.
The pupilometer has been an asset to our ICU in that it's one more tool that very definitely allows us to monitor our patients, act early, intervene, notify the physicians.
The pupilometer is a handheld, cordless, and lightweight device which is fast and easy to use and requires no calibration by the user.
The pupilometer's made our job easier. It's a very nurse-friendly tool.
In addition to accurately measuring size and reactivity, an algorithm inside the pupilometer, called the Neurological Pupil Index, or NPi, compares the measurement results to normative data and grades the pupillary reaction on a scale of 0 to 5.
The pupilometer is very useful in helping us to document the pupil size and also to track the changes in pupillary function. And it's all done in a computer manner so that there's no guesswork.
The measurement results are instantly displayed on the device's easy-to-read color LCD screen and are saved in memory and can be sent directly to a printer via infrared link.
We are totally dependent on it for the exact measurements of our patients' pupils.
The video playback feature displays measurements of both eyes side by side for easy comparison.
The pupilometer is something that we could never work without.
The Neuroptics NPi 100 Pupilometer is an important tool to help clinicians optimize patient care by removing subjectivity from the pupillary exam.
I think as we look at the evidence of how a pupilometer works, the quality of the data that we get from the pupilometer, it is well worth our investment to have this non-invasive ability to accurately monitor our patients.
It's worth every penny to be able to offer the best care we can to our patients and to give our neurosurgeons and other physicians at the facility the information they need to provide the best patient care.
For more information, please contact Neuroptics.